Is the healthcare profession doomed? It's obviously not in good shape at the moment. This profession, which has historically been based on charity, good science, and strong patient-physician relationships, has become dominated by guys with business degrees, paper-pushing administrators, and health insurance representatives who've never touched a patient a day in their lives, and who are now telling physicians how to practice medicine. If you're pursuing medicine to become a physician, have you chosen the wrong profession? Should you leave like yesterday? If you're a patient, how do you navigate and survive this chaotic modern healthcare system? Let's back up for a minute and talk about the current state of healthcare in the US. Healthcare has undergone major transformations over the past decades, and many of them have impeded the ability of physicians to properly care for their patients and to stay satisfied in their careers. The healthcare system has become one that is simply not sustainable. For instance, the cost of seeing a physician, performing diagnostic tests, and getting appropriate medical treatment is steep and unaffordable for most. Think about the last time you got a bill from a doctor's office or a hospital. Even with insurance covering, you probably had to pay a significant amount of money toward your deductible and thought, why the heck do I even have insurance? Insurance companies are refusing doctor-prescribed treatments and diagnostic tests that are medically necessary, leaving patients without appropriate care and rendering physicians unable to adequately care for their patients. Corporate entities are buying up hospitals and pushing what I like to call Walmart or factory line medicine. These corporate hospitals falsely advertise a promise for high-quality patient care and secretly push their number one agenda, which is to ensure that their shareholders profit each quarter, often at the expense of the patient. Patients are not happy, doctors and nurses are not happy, patients don't trust the system, and rightfully so. Physicians are burning out and even worse, committing suicide. So, with all that enlightening, cheery information that I've just mentioned, is the healthcare profession doomed? In my opinion, there is still hope for the medical profession. Think about it. People will always need and appreciate skilled, intelligent, and caring physicians. It just involves some out-of-the-box thinking, courage, and cultivation of one's own creativity. It is for this reason that I am launching a new sub-series on my YouTube channel called Lessons I've Learned as a Physician: How to Survive and Thrive in the World of Modern Healthcare. In this video series, I will share lessons that I have learned to prevent physician burnout and to increase both physician and patient happiness. Some of these lessons are directed towards young physicians in training, and others will be geared toward anyone who is or has been a patient to help you get the most out of the healthcare system and to get it to work for you. My lessons don't involve being on committees to try and convince executives or bean counters what is best for patients, or expecting that the modern healthcare system is going to miraculously change with government intervention. My lessons involve taking action from an individual standpoint. After all, only you really have the power to control your actions and decisions. Stay tuned for episode 2 to come out next week. This is NeuroGalMD, and thanks for joining me today. Make sure you hit that like button if you enjoyed this video and want more of this type of content, and please hit that subscriber button to stay up to date on more incredible videos. Stay sassy, and we'll catch you next time.